Today, we're diving deep into the world of esophageal motility disorders. These conditions affect the esophagus, the muscular tube that carries food and liquids from your mouth to your stomach. When the esophagus doesn't contract properly, it can lead to a variety of uncomfortable and sometimes serious issues. Join us as we explore the causes, symptoms, diagnosis, and treatment options for these disorders. So, what exactly causes esophageal motility disorders? The etiology can be complex and multifaceted. In many cases, the exact cause remains unknown, classified as idiopathic. However, several factors are known to contribute. These include damage to the nerves and esophageal muscles, perhaps from diabetes or other neurological conditions. Certain autoimmune diseases, like scleroderma, can also affect esophageal function. Sometimes, prior surgery on the esophagus, or even the natural aging process can play a role. Infections like Chagas disease can cause motility problems, particularly in certain regions of the world, and in some instances, there might be a genetic predisposition at play. Let's delve into the pathophysiology, or how these disorders actually disrupt normal esophageal function. The esophagus relies on a coordinated series of muscular contractions, called peristalsis, to propel food downwards. It also depends on the proper relaxation of the lower esophageal sphincter, or LS, a valve at the bottom of the esophagus that prevents stomach acid from backing up. In motility disorders, these processes are disrupted. This disruption might involve weak or uncoordinated contractions, failure of the LS to relax properly, or even excessively strong contractions. The result is difficulty swallowing, food getting stuck, heartburn, and other related symptoms. The specific mechanism depends on the particular type of motility disorder. Regarding epidemiology, esophageal motility disorders are not uncommon, but precise numbers are difficult to determine, as many people may not seek medical attention for mild symptoms. Some conditions, like achalasia, are relatively rare. The prevalence of other disorders, such as diffuse esophageal spasm, varies across different populations. Certain factors like age, underlying medical conditions, and geographical location can influence the risk of developing these disorders. As diagnostic techniques improve, we are getting a clearer picture of how frequently these conditions occur. The signs and symptoms of esophageal motility disorders can vary greatly depending on the specific disorder and its severity. Common symptoms include dysphagia, which is difficulty swallowing. This can manifest as a sensation of food being stuck in the throat or chest. Chest pain, often described as squeezing or burning, is another frequent complaint. Heartburn, regurgitation of food or liquids, and even unintentional weight loss can also occur. In some cases, individuals may experience coughing or choking, especially when lying down. The symptoms can fluctuate in intensity and may be triggered by certain foods or activities. Diagnosing esophageal motility disorders typically involves a combination of tests. A barium swallow is a common initial test, where you drink a liquid containing barium, which shows up on X-rays, allowing doctors to visualize the esophagus and how it functions. Esophageal manometry is a more specialized test that measures the pressure and coordination of esophageal muscle contractions. Upper endoscopy, using a thin, flexible tube with a camera, allows for direct visualization of the esophagus and can rule out other conditions, such as tumors. Sometimes, a pH monitoring test is performed to assess the amount of acid refluxing into the esophagus. The specific tests used will depend on the individual's symptoms and the suspected diagnosis. Esophageal motility disorders encompass a spectrum of different conditions, each with its own unique characteristics. Achalasia is a well-known example, characterized by the failure of the LS to relax and impaired peristalsis. Diffuse esophageal spasm involves uncoordinated, forceful contractions of the esophageal muscles. Nutcracker esophagus, or hypertensive peristalsis, features excessively strong esophageal contractions. Esophagogastric junction outflow obstruction refers to the functional blockage of the passage of food from the esophagus to the stomach. Ineffective esophageal motility involves weak or absent esophageal contractions. These are just a few examples, and the classification of these disorders continues to evolve with ongoing research. Treatment and management strategies for esophageal motility disorders aim to relieve symptoms, improve esophageal function, and prevent complications. Treatment approaches are often tailored to the specific type of disorder and its severity. Medications, such as proton pump inhibitors for acid reflux, can help manage symptoms. Botox injections into the LS can relax the muscle and improve swallowing, particularly in achalasia. Esophageal dilation, using a balloon to stretch the LS, is another option for achalasia. In some cases, surgery, such as a Heller myotomy for achalasia, may be necessary to cut the muscle of the LS and allow for easier passage of food. Lifestyle modifications, like eating smaller meals, avoiding trigger foods, and elevating the head of the bed, can also be helpful. Preventing esophageal motility disorders can be challenging, as many of the underlying causes are not fully understood. However, there are steps you can take to reduce your risk or manage your symptoms. Maintaining a healthy weight, avoiding smoking, and limiting alcohol consumption are generally beneficial. Managing underlying conditions such as diabetes or autoimmune diseases can also help. For those with diagnosed motility disorders, following dietary recommendations, such as avoiding very hot or cold foods, can help minimize symptoms. Working closely with your doctor to monitor your condition and adjust treatment as needed is crucial. The prognosis for individuals with esophageal motility disorders varies depending on the specific disorder, its severity, and the individual's response to treatment. While these conditions can significantly impact quality of life, many people can effectively manage their symptoms with appropriate medical care. Recent research is focused on developing more targeted therapies, including novel medications and minimally invasive surgical techniques. Studies are also exploring the role of genetics and the microbiome in the development of these disorders. Advances in diagnostic techniques are leading to earlier and more accurate diagnosis. As our understanding of esophageal motility disorders grows, we can expect to see even more effective treatments and improved outcomes in the future.